This video will cover congenital dyserythropoietic anemia, which may lead to disorders of marrow production. To anchor ourselves, we'll use this fish, which looks a lot like a certain character named Nemo from a famous children's movie. And Nemo sounds like anemia, right? Additionally, this scene takes place at what looks to be like a driving school for CDL licenses. Congenital dyserythropoietic anemia is shortened to CDA, and CDA is close to CDL, right? Altogether, this CDL school alongside the Nemo fish will anchor us to congenital dyserythropoietic anemia. There are two groups of people here. The ones behind the wall, who I'm not sure they're ever going to make it to their destination, but that's besides the point, and the ones who have a clear path to the building. These two groups represent the two different types of CDA. The group that has more people represents type 2 CDA, which is more common than type 1. Type 2 CDA is also inherited in an autosomal recessive manner, which is represented by the toy car next to the group of people. This guy is drinking some really questionable liquid here. It looks like a test tube with some sort of acid. This represents the acidified serum test, which is positive in type 2 CDA. You see how the wall is painted? I'd say that these circular objects resemble red blood cells, don't they? But more specifically, these represent red blood cell precursors, which, as we know, are nucleated. Notice, however, how there seems to be multiple nuclei in these RBC precursors, which is not normal. Type 2 CD8 commonly shows multinucleated erythroid precursors with abnormal mitoses and increased karyorrhexis. Karyorrhexis is represented by the artist's motivational phrase here that says, "carry on," since carry on sounds like karyorrhexis. Abnormal mitoses are represented by these abnormal mice on the wall and on the ground. Let's move on to type 1 CD8 now. This bridge they're crossing represents dysplastic erythroid precursors with frequent internuclear bridges. Self-explanatory. The semi-truck with both large eyes and small eyes on it represents an increased density of the big I antigen and the little I antigen on red blood cells in type 1 CDA. Since only the group of people in type 1 CDA can access the semi-truck, we can remember that this is unique to type 1 CDA. The poster on the wall here will clue us into an electron microscopy finding. Since electron microscopy usually is in grayscale, this poster is also like that. Additionally, it looks like the artist's initials are EM, which will remind us of electron microscopy. The classic finding in these patients is an abnormally abundant amount of endoplasmic reticulum located adjacent and parallel to the cell membrane, which resembles a double cell membrane. The artist is protesting, asking for more protein, which represents increased amount of endoplasmic reticulum in these cells, since the endoplasmic reticulum's main function is protein synthesis. To remember that the excessive endoplasmic reticulum accumulates adjacent and parallel to the cell membrane, resembling a double cell membrane, we'll remember this battery the artist included, which looks a lot like a very famous brand of batteries that sounds kind of like double cell, right? I think he chose to include this here to represent that the people have the power to protest for more protein.